Hi everybody, welcome to week 6 of advanced assessment. Week 6, you are getting there. You will make it. All right, so this week, spiritual assessment, kind of an interesting topic and one that we don't always get into as nurses. Some areas probably more than others, hospice, other things. But on a routine daily basis, maybe not so much. All right, my thought is the more comfortable you are in identifying your own beliefs, values, faith, structure, whatever, the more comfortable you are in asking that about other people. So, I would suggest to become more comfortable with spiritual assessment, make sure you know where you're at with your own beliefs. And exploring that can help us also bring up some maybe preconceived notions or biases regarding certain belief systems. And once you identify a bias, then you can make sure you don't come across as non judgmental. Whereas maybe if you hadn't identified a bias, that could come across almost subconsciously when interviewing a patient. Just some food for thought. All right, spiritual assessments. So we've got some discussion questions this week about spiritual assessments. One, a patient who's kind of less than forthcoming in that area. And then another, a student who maybe doesn't want to go down that path. So in DQ1, you're the nurse and you're working with that patient. But in DQ2, you're the instructor working with that student. And so DQ2 is more, how would you address this with your student? DQ1 is more you dealing directly with the patient. Some of my students have gotten that a little confused in the past. So we've got those two discussion questions. And then we're going to be analyzing some spiritual tools, some spiritual assessment tools. And I know if you're like me earlier back in my career, I had no idea there existed spiritual assessment tools. On my admission assessment, I asked them if they had a religion and if they wanted to be visited and if they had any spiritual or cultural beliefs that we should be made aware of. And that was pretty much it. As I got further along in my career and began, I think, dealing with my patients maybe on a deeper level, talking with them about beliefs and how their diagnosis and prognosis was affecting them and something like that, I think I got more into deeper discussions with my patients. But, you know, depending on what area you work in, maybe that hasn't come up a lot. So at least you'll be exposed to some different tools that can help you if you find yourself in a situation where you need to be working with a client that's struggling with that. So you're going to be analyzing some tools. Please remember there is a whole section on the rubric about did you look at reliability and validity of the tool. So you have to mention that, regardless if it's good or bad or whatever. Also in the rubric, there is a little extra component about how the spiritual assessment tools could be used during a health assessment. That isn't in the directions, it's just in the rubric. So really make sure that you read that carefully. And this paper needs to be backed up with quite a few resources. You have to go out and get additional ones other than your textbook. And that's where you might come across more information as far as reliability and validity, that sort of thing. So it'll take a little digging to do the paper, but I hope you find it interesting. And then week 7, if I'm correctly remembering, week 7, I don't think we have an assignment. But week 8, be sure to look ahead because you've got your final CLC assignment. And in that one, you're going to have to go out and find people who are able to take an assessment for you. Now, you're going to be looking for 10 individuals. They cannot be current patients of yours. They can't be actual patients. So family, friends, neighbors, acquaintances, all that good stuff. But no patients that you're caring for, okay? So please be sure and look that up. I think at least one of your groups has just started looking at that. So I would suggest that all of you look at it so you get a nice head start and nobody's stressing out at the end of the course. Okay? All right, so I think that's about it this week. I'm looking forward to some good discussion about where we go with spiritual assessment of our clients. When is it necessary? We'll see what we come up with. All right, see you in the main forum.